Good evening. Tonight's lecture is very concentrated lecture and very important. So for some of you who have watched me before, we're not going to waste lots of time talking about anything personal or anything like that because we have to present. I had to go over 189 scientific papers to read, to summarize in 90 minutes or 80 minutes for you. And what I'm going to do tonight is I'm going to make it easy for you because if you want to get the DVD and you want to review it yourself or you want to show it to college or audience or people, we will put the scientific paper on itself for a few seconds because it will be on the DVD, and I will remove it and then I will explain it in one of my transparencies again, and then we put the second one, we'll go from subject to subject. So we have a lot to cover about the fish. The reason omega-3 became very popular is because in 1950 there was a study done. They find that the Eskimos have almost zero heart disease. They might have rheumatic heart disease, but they had zero heart disease. The Eskimos, that's how the interest in omega-3 started in research. They have absolutely zero, and they eat lots of fat all the time, all day. They eat fat from the seals and animal bird, and they have absolutely no clogged arteries and no heart disease, no cardiac arrhythmia, no diabetes, and no hypertension, and no depression, no suicide, and none of the stuff we have with metabolic syndrome. They don't have it. Okay, so they decided to investigate what's going on, with their diet. Then they concentrated. They find out that it is omega-3 fatty acids is the biggest problem, is the biggest benefit that they found that the people consume. I'm just going to get a little bit more of these here. I'm sorry. Okay. If we look at the map of the world in general, you will find out the human race since the beginning of history, since Adam and Eve were landed on this earth, everybody went by the sea. They always concentrated around the shores. Very little people were in the mountains and everybody around. So if we go to Africa, for example, this is where the first man was created on women. Then we see most of the people concentrated in the area around the oceans. If we go to India, and that's part, you just can imagine this part, whatever, India and Asia right here, also there's the same thing. I should make Africa a little bit smaller, but I didn't. And Italy is right here, and England and Ireland right there. Maybe make Ireland bigger like this. And so the people also live around concentrated like this. United States, the same thing, and Mexico and South America around the sea. Then we lectured last time. We were here on metabolic syndrome X. You heard it, but today we're also going to repeat metabolic syndromes a little bit in today's lecture because it's omega-3 also have a big part in it, and then we're going to explain that. If we take United States itself and find out about why do we have so many problems, we will find out the reason we have so many problems in United States is because three reasons. Well, nutritional problem we have, stress-related problem we have, and toxicity-related problem we have. So we talked about that for the last 30 years. I've been saying the same thing. These are the three major thing causes the big deal is diseases. Okay, the nutrition part, which here is what we're here for today, is protein, carbohydrate, fat, vitamins, water, mineral, all of the stuff. Here we are talking about the fat part, which is the omega-3 complex. Okay, so if you think that we do have a problem with, let me see, is this focused for you? All right. If we look at the United States, we find out that we have, oh, we didn't talk about toxicity right here in this one. The toxicity part right here also plays an important part of the disease. And if we going to depend on fish itself to eat fish like the Eskimos doing, we're going to have lots of mercury and lots of DDT and lots of PCB in our brain and our diet, because, California just outlawed selling that tuna company have to put a warning sign on their cans that tuna might cause brain damage. And also, that mother milks, I showed you an article, I think, one time right here, that flame retardant, PCB, was found in mother milk in 100% of American women. 100%. That includes everybody who eats fish, doesn't eat fish, have it. And this article was printed in USA Today, and that in the journal. So there is lots of toxicity in the fish, if we're going to talk about fish. However, you can select the kind of fish you're going to eat, and usually the cold water fish is better than the warm water fish, and usually the farm-raised fish are worse than wild fish and things like that. So you can really be choosy about what type of fish you're gonna eat. If we look at the nuclear exposure in the United States, in the waste sites around the country, this is by the Nuclear Energy Commission in the United States. They publish these reports for us, and we see that around Illinois right here and Wisconsin, there is quite a bit of nuclear waste sites. So there is a possibility also that the fish, some of that stuff might go to the rivers and also contaminate the fish. This is why food supplements becomes very, very important part of it, that omega-3 in supplement form is probably the best way, the safest way, because Shaklee omega-3 especially, they go through so much to be sure that there is no toxins in it at all, and be sure all the ratio between omega-3 to omega-6 is very well proportioned in their supplements. You got the omega-3, you got the GLA, which is omega-6, and then in omega-3 you got the DHA and the EPA, which we're going to be talking about it in a minute. But I just want to show you, these are the things that, so we have, now we understand that these Eskimos, they live on fish, they mainly salmon, and they fish. This is ice fishing right here, and that's what they do. And I just wanted to, I'm going to have to refer also to my notes once in a while right here, because I don't want to talk from my memory. I have already 20 pages I written right here for the lecture, and I have to follow exactly what I have here. If we look at the fatty acids that we're called omega-3, we find out those fatty acids are divided to 3 categories: the alpha-linolenic acid, and then the EPA, and the DHA, and they have scientific names you can see they have to it. But one of the important things we're gonna have to differentiate between Shaklee omega-3s and others. We're going to have to understand it is not only the type that we are looking for. Are you following me or no? We're also looking for the atoms. How many atoms? You look, is this a short or long atoms, So we have alpha-linolenic acid. You see it has 18 carbon atoms right here, and it tells you in the bottom right here, the 18 indicate the number of atoms, and then here it indicates a number of the bonds. The double bonds inside are so important to the fish oil, the EPA or DHA. It's so important to have double bonds, especially the 3. 3 bonds are extremely important to have 3. So we have The EPA have 3 right here, but we have also, HA also have 3, but have longer carbon atoms. So they both complement each other in many ways. But one of the things I want to see very well right here, there's a difference between omega-3 long, this is long, again, natural, healthy, good and everything, but there is a difference between processed in high heat and low heat, and exposed to different temperature and stored in oxygen, not oxygen. Here's what happened. If you look at this, this one and this one right here, you see the carbon atoms between them. There's a double bond right here. And if they are in the same direction, that's natural. Like this one right here, this is natural right there. If they are one up, one down, that is being damaged. And when they are natural, they are bent like this. When they bend, they can work in the brain and they can work inside the body. When they straight, they can't work very well inside the body. You cannot move. Are you following me or not? So the reason I leave the picture for a while, so you can get it on the screen, because this here, I'm going to need it later on. So we're going to move to the next slide. I also brought you something you might like very much, which is actually the what type of fish, what type of oils we should eat. And here is a picture to show you from the last one. We had differentiated between the shorter chain and the long chain, and the one has omega-3 and the one who does not. We find out that the butter and olive oil and corn oil and canola oil and coconut and flaxseed oil, none of them have the EPA and DHA in it. So they don't have that in it. So they are beneficial to the body to have olive oil and all of this, but they don't have the long chain. And it is the long chain we are after, and also shorter chain. Don't forget the nuts and olive oil with your salad and all of that are very important. But you cannot ignore the long chain right here. And then the long chain group, the more EPA, the better it is. The more DHA, the better it is. So you can see anchovy, for example, which everybody hates, it becomes one of the top in the list. You can write here mackerel, becomes that everybody throws away when they fish. They use mackerel as a bait. They don't eat it themselves. They give it back to the fish. Again, in California, when I go to the pier and watch people, they get the mackerel, they use it for bait, but they keep the other contaminated fish. So this is the type of fish right here, and we can see that the one who have the most right there is going to be the best. Here is salmon. Wild salmon is in the top of the list of the EPA and DHA also. And then you have also, even the canned salmons showed right here to be good also. And sardines also good. Trout also good. And tuna is also good. Mackerel is good. And cod and all of that stuff. Even catfishes have, they all have a lot more than flaxseed anyway. So we can't really say, I'm taking flaxseed oil, I'm taking omega-3, you're not taking omega-3. So we're going to keep this table on the side right here also until we come to the next one. One of the important issues right here we like to talk about is what happened when EPA and GLA enter the body. The EPA is omega-3. The GLA is omega what? It says right there omega-6. The ratio between omega-3 and omega-6 has to be maintained 3:1. So the amount of omega-3 you take to omega-6 has to be 3:1. But in the meantime, if you're not taking the other supplements and you're not taking care of yourself other ways, you can convert omega-6 right here to prostaglandin, which cause inflammation. You can convert it to omega, to different prostaglandin right here. Even EPA itself can be converted to a harmful inflammatory substance. Omega-3 can be harmful if the rest of the diet is not a good diet. Are you following me or no? So don't think just taking one item and you are safe. No, you have to be complete in your diet. The thing you notice right here, I'm going to put this back right there again, that every component right here, like we take the alpha-linolenic acid, which is the fish converts to EPA eventually, or GLA, they all, when they enter the body, they get converted to something else. Like GLA have 18 carbons, and it has, you can see that the structure for it, it gets longer with an enzyme called elongase. Elongase means it gets longer, and then it gets converted to arachidonic acid right here, which is not bad for us. We need some anti-inflammatory stuff like that so we can fight bee stings and all that, but we don't need too much of it. We need some prostaglandin, but we don't need lots of it. So this is a problem that we are facing with, that some of these components right here we don't have enough in the diet. I wanted to just get directly to the human body and show you that the most important part of the omega-3 fatty acids is they go inside the cell and then they do something inside the cell. The human cell, it looks like this, looks like that, and it has a membrane. It is the membrane of the cell that allows food to go in. And if the food does not go in and the supplement doesn't enter, then you are empty. The cell is empty. Inside the cell, there's a nucleus, which you have a DNA. In the nucleus also have a membrane. Are you following me? Without a proper membrane, then also the cell will be useless. It has mitochondria right here, which burns and give you energy. Without the mitochondrial membrane, proper membrane, you're also not going to have energy. You're going to have fatigue all the time and tiredness, and you cannot think, you cannot function, actually. As a matter of fact, this is a good opportunity for me right here to put something important. The cell have lots of receptors right here to receive the food, like guys sitting with hands in and out like that looking for food and take it and put it inside. Those guys transporting food from outside in, but in people with syndrome X, which we're going to talk later, they don't have good membrane. Their membrane is covered with a layer of fat called VLDL outside and VLDL inside and even homocysteine outside and even many layers. And there is lots of atherosclerosis, lots of layers like that through the whole body. So no wonder we get tired and fatigued and yawn, and we'll be driving down the road and we don't know, we need energy, we need to think, we need to concentrate, because the brain, which consumes 70% of the sugar you eat, 70% of the sugar of the body goes to the brain. 30% only go to the muscles. So the brain is more important than the muscles. But in monkeys, that the scientists think we came from monkeys, they only consume 5% of the sugar goes to their brain and 95% in their muscles. So there is a human difference right there. Scientists should really pay attention to. So only human consumes 70% of the sugar goes to the brain. So only species on Earth. The fish 1%. Whales is 2-3%. Monkeys about 4-5%. But to come closer to human, 70% of the sugar. Why? Because the brain is a furnace. It's full of energy all the time. All the time. There is millions of reaction. You're thinking all the time. You know what's in front of you, back here and there all the time. What you're going to do tomorrow, yesterday, how you solve a problem. That is human being. That's what makes us special. But the thing about it, for the sugar, glucose, the sugar, to enter the cell, many people have the idea that especially you be careful these days, that people introduce you to so many new food supplements in the market, and they tell you, take this juice, take this product for energy, take this, take this. Be careful. Human body doesn't work that way. Human body is selective. I mean, things has to be transported through mechanisms, not just take it and you're going to feel good. One of the things very important is the protein right here. I should use a different color so you can see it. Is a protein right here, an enzyme. This guy right here, which have a head and legs like that, he sits by the nucleus all night. And then at 4 o'clock in the morning, he will move toward the cell, because this guy sitting in the cell right here, he got a message from the mitochondria, because as a chemist here, he is going to start the furnace, and then he send him give a message and tell him, I need sugar. This guy here puts his hand out and gets some sugar. He puts it inside the cell here and leave it. He called this guy, which his name is GLUT4. GLUT4, glucose transport number 4, GLUT4, will come toward the surface, grabs it, take it to the mitochondria, and burn that comes back. In human being, people who get tired, they don't have enough GLUT4. They eat sugar, they eat carbohydrate, but still tired. They still kind of thing, because number one, the transport from here to here could be defective. That's we're going to talk about diabetes. And also could be arteriosclerosis. Hardening of the cell itself is loaded with some other junk. But GLUT4 is very important. We're going to mention it later on in the lecture. That's a human cell. Inside the cell is the DNA. The DNA, it has the genes in it, like that. And we have identified 25,000 genes in the DNA, and we know there is about 4 million reactions in any seconds going on in between the genes. And all it takes is damage to one of the DNA component, gene component, and you have a problem, like syndrome X we talked about last lecture. It's damage. Our parents gave it to us. Our grandparents gave it to us. We talked already about it in the lecture. So you have to understand you can reverse that. Right now we have 60 patients so far on a special diet I formulated in my office after we do the people blood tests and everything like that, which have fruits and vegetables and things like that. So far, 58 of 58 people use this diet to try to reverse this mechanism with vitamins and nutrition. They feel better. So it is possible that we can reverse some of these problems. Now, the human body inside has cells. I'm just going to give you examples of the cells. Some of the cells looks like this kind, it's called simple cell. Some of them look like that. Some this is the cells in the kidney. This is the cells in the digestive tract. The reason I mention all of this to you is because people do all kind of things to their digestive system, and they think they're doing good to it. They don't understand digestive system, like they take, for example, enemas or clonics or all this stuff. They think they're taking toxins out of the body. You can't take toxins out of the body. You can't, because look at the digestive system cells, how long they are. You know, they're not going to allow your enema right here to come through the cell and take toxins from the body. There's no way they're going to do that. Are you following me or no? You basically have to slough all the cells out to enter the blood, and by that time you bleed to death anyway, so you're not going to detoxify, you're going to hemorrhage instead. So this is a type of cell, and that's what they look like, and I want to show you a different, this is the first time I show you these cells anyway, I just wanted you to look at it. These are the kind of cell in the trachea, for example, right here. Also different kind of cells, and this is a cells down right here which have hair to try to secrete mucus plugs so you can cough the viruses out right there. So the human body is very highly specialized. The reason I move it so fast because the camera has already taken the picture and you can pause it if you have the video. Okay, here is another cells in the urinary tract. Different looking cells. You see, they have two types of cells right here in the urine. one, because kidney is very complicated organ, it has to filter the whole blood every 30 seconds. It has to filter all the blood all the time, like over 20,000 gallons a day. It filters the blood, so it is very complicated. So those cells also needs omega-3, and they are important. We're going to go over that. The reproductive system itself, right here, also the penis have different cells, the tongue have different cells, and then those cells are here's one cell is enlarged to you see the receptors over there in the top to grab food for us. You can see that when I'm talking, those guys with hands. Right there they are. And this is the mitochondria is right there. This is the nucleus right here. But look what the cells do to each other right there when they touch each other. You see that right there? I don't have a pointer with me today. But right here, when they touch each other, they communicate also with each other. They talk to each other. If one of them decides to become cancer, the next cell next door will kill it. Will actually tell the brain, there's a cell next to me, is going to become cancer. I want you to come and destroy it. And the macrophages and the monocytes that will come in just to take it off immediately. So you probably didn't know that there is communication sideways between the cells also. They communicate all the time. So this is a picture of the human cell itself, again, magnified. These are the guys who receive right here. Okay? This is the microtubes inside the cell that transport things. This is GLUT4 right there. You see many things right here, but here's the mitochondria right there. See mitochondria right here. This one here. And that mitochondria right there is what the energy is being produced. But there is lots of other things goes on with the cell. So I want you to remember that omega-3 function, let me just find where does the cell go? Right here is the cell. Omega-3 function is number 1 and 100 even. It works right here in the membrane, right there. This membrane right here is made of omega-3 mainly. Around the nucleus, omega-3. Around the mitochondria, omega-3. Are you following me or no? So the fatty acids we discovered 1976 and then 1996, we didn't know what they are. They were fat in the cell. Now we identified that it is polyunsaturated fatty acid is omega-3 with EPA and DHA. You know, that is what we know about it. And then and inside the nucleus, we have what you already know. What is this in front of us right here? Inside the nucleus is the chromosome right there. This is the enlarged picture of it, the real picture of what the chromosome looks like. It has proteins in it, and those makes the genes. And there is 25,000 of those components inside the cell. Out of the 25,000, they determine your health, you're going to live or die, what kind of disease you're going to have, what kind of offspring you will develop. These genes, some of them called a nutrition gene. A nutrition gene inside you, it tells the body it has its own communication with you. It tells you, I need more vitamin C, I need more vitamin E, I need B-com, I need this and this. And those, the nutrition gene, they determine the amount of activity of specific protein produced by the human genome by function regulating gene transcription, nuclear RNA processing, and messenger RNA, and so on. In the very end, you probably fall into sleep with all of this stuff, but in the very end, the nutrition gene is responsible for having more energy in the body, less fatigue, less cell differentiation, and less cancer, and cell growth is controlled. So the gene itself, the nutrition gene, controls who's going to have cancer, who's not, who is, how you defeat cancer, because the body gets rid of cancer every single minute. We have cancer cells that's been, it has been destroyed. Okay, The some of the cells in the body, this is now we're getting closer to walking inside the body. We're going to be talking about circulation right now and how omega-3 works in the circulation. The endothelial cells, let me just take this out and show you. Inside the arteries, this is an artery right here. And it looks like that. And it has cells like that in it all over. These are the cells. Those cells inside right here, the inside one called endothelial cells. The endothelial cell in the artery, they're responsible for giving you circulation all the time, allow you to have enough circulation. The distance from the heart for the blood to go out to the fingertips and come back is 1 million miles. That's how long the arteries are, 1 million miles of arteries. This is the miracle of God created us that way. The animals also have the same thing. So these arteries right here, those cells, if they have too many chemicals, too many sludge buildup in it, like here, will be hardened, right? Will be sick. So let us show you some of the diseases it will happen if we have endothelial dysfunction. What causes the endothelial dysfunction that you develop high blood pressure, arteriosclerosis, heart attacks, and all of these things right here. Age it can cause it. Heart failure, endothelial can cause heart failure. Endothelial dysfunction causes diabetes. Diabetes can do the same. And you can see lipids, smoking, all kind of things right here that makes the circulation worse. We're going to move in, because you have seen those pictures in the past, to show you, to remind you by some of the arteries we have shown you. This is an artery which is full of plaques right here inside, from a man who's a 47 years old man who died from myocardial infarction. And you can see the deposits of blockages especially in the left leg right here. There is a blood clot right there, and then this going to the kidneys. And if we look inside the body, we'll find out that that this right here, let me use one of the used ones right here. You can see right there a beginning of artery start having blockage in a child who is about 4 months old. Okay, this is the mother delivered the child probably with the metabolic syndrome, and that's last night I had my nephew came to me, and he's a orthopedic. He's 28. He's an orthopedic fellowship in Rush, one of the best schools in the country. And he came to me to check him out yesterday between surgery. He's doing surgery, and he said, "Can I come? You examine me and check me out and go back to surgery again." I said, "Come over from Chicago." It took 1 hour to come, 1 hour to come back. I checked him out, and then I told him, "As long as you are here, can you come to my house tonight? I want you to give me a shot on my knees, you know, the Sinovex stuff." I told him, "Why don't you bring me some and put it on my knee?" And then he came over. I made some tea for him, and then I had to bite so hard because it hurts. You had it done, right? Then I was talking to him. I said, "It's amazing." I told him to take care of yourself, take vitamins, do good, because he's junkie eater, and he is not doing well taking care of himself. And he said to me, "We have patients." I told him, "Do you know there are patients ages 20 and 30, even 8-month-old with heart disease?" He said they have patients 13 years old on high blood pressure medicine. 13 years old on high blood pressure medicine. So if you were here last lecture, metabolic syndrome is a very, very serious problem which causes all these blockages that I have mentioned to you. We're going to go to this picture right here to show you. This is a 38 years old man, victim of homicide, and this is his artery. What do you see right here in this bottom part right here? Let me raise it up like that. What do you see there? Does this look like crystals to you or not? Okay, that's hardening of the arteries right there. That's what kills us. This exists in every single one of us. I have a new machine in my office, from Germany. It's a new machine to check the heart, see circulation in the heart. Every single patient over 40 we have done shows blockage. And we have the machine now for 8 months. Every patient. We have done maybe over, we do about 5 a week to 20 a month. In 8 months, 160 we have done, and 100, include me, 160 have blockages. So none of us gonna escape that unless you go take care of yourself. And omega-3 right here comes out to be a shining star, because probably it's gonna be the food supplement of the future. You know, that is what's gonna happen, because every day we discover new things to it. This is actually the heart itself. Let me just put it right like this. This is the heart itself, how the arteries look inside the heart. And the reason I put that on, because that's my heart, actually. And my name is in the top right here, says Nasr Mohamed right there. And when we did that, we discovered there was some deposits, little bit deposits. Not much, but there is. So I thought I'm really, really clean. I do good job. It was not good enough. I still developed something because hereditary plays a factor. Now we're going to present the first paper right here. It's called the Primary Cardiovascular Prevention. And to talk about that, actually I'm going to remove that and put the secondary first, because that's how I wrote it in my book here. So that's how I'm going to do it. Okay, I'm just going to raise this up right here for a minute right here, that the study have shown that the omega-3 from plants, from flaxseed and things like that, if they have a little bit, the short chain omega-3 from plants like seed and flaxseed and nuts and all of these things, leafy vegetables and butter and oil and canola, all of that, they do have benefits also inside the body. The short chain flaxseed oil, they are very good in preventing secondary myocardial infarction. Like if you had a heart attack, the second one will be prevented with flaxseed oil. It's good at that. But the long chain have shown this is the long chain amino acid omega-3. There was one study, they given lots of fibers to somebody who eats lots of fibers and less fat in the diet. And the other study, they give him more omega-3 with fibers, and the mortality from a heart attack decreased by 29%. So omega-3 by itself decreases heart attacks by 29%. There is another study, it's right here, it is 11,000 patients, and the survival of myocardial infarction in that case was checked, and we find out that group 1 was given 1 gram of omega-3, and group 2 was given vitamin E and placebo, okay? In group 1, have decreased sudden death, decreased decreased sudden death by 24%, decreased triglyceride, decreased VLDL, decreased mortality. We put this here, and then I will go to the primary one, which I put before, because that's really the most important one right here I want to show you. And the reason I put it there, because I want it to be on the camera. The primary, there was a study shows that that there was 20,555 patients in the study. The people who have eaten 1 fish per week and people who are eating less than 1 fish per week. The people who ate 1 fish per week or more have 30% less sudden death from a heart attack. You follow me so far or no? That is, of course, we're not talking about pregnant women here, because pregnant women are not supposed to eat fish, because the mercury and this can go to the baby, and that's very dangerous. The Honolulu study program right here studied the Japanese American living in Hawaii who were heavy smokers. They selected the people who smoke more than 30 cigarettes a day. And those smoke more than 30 cigarettes a day, they give them omega-3. The risk of sudden death decreased by 50% by eating 2 fish per week. You see how important it is. In King County, Washington, omega-3 in the cell membranes, we talked about the membrane. This is the scientific papers I'm presenting. It increases the fluidity in the brain. It decreases cardiac arrest by big percentage. In the nurse study, omega-3 reduced blood clots and decreased stroke. In physician studies, also decreased the stroke. So omega-3 has been working against stroke, against sudden death, and also eating fish is important. So this study will go right here, and I will go to the next one, which will be the irregular heart. Irregular heart is a very dangerous process. When the heart goes out of control, it can stop, right? Okay, so the omega-3 is being proven to be anti-irregularity. All the studies we mentioned before decreases mortality, arrhythmia by 50%. So if you have irregular heartbeats, omega-3 will decrease it by 50%. It doesn't matter if you take a medicine or not. So that's a very important issue right here. But increasing the omega-3 in the cellular membrane improve electric conduction and excitability in the membrane and fluidity, and improve the work inside the brain and the ion channels, and prevents the membrane being unstable. What it means that to have irregularity in the heart, because the membrane itself, the electrons from outside to inside going in and out, they are not stable. That's why the heart stops. And there is antiarrhythmic effect of fish oil seen in that article. The next one here is really important for people who have triglycerides, high cholesterol, and want to do something about it. And let us see what the study shows on triglycerides then. The triglycerides are extremely dangerous, especially in women. For some reason, if a woman has high triglyceride, she develops heart attack much faster than men do. So it is very dangerous to be overweight. It's very dangerous for women to have high triglyceride. Omega-3, in 65 study, decreased triglyceride by 35%. That is in the fasting group. But I want to tell you something about the fasting blood test. Fasting blood test is misleading blood test. Because I always told my patient, all day you're not fasting, why you come to me fasting? Because when you fast, you're going to give me the best picture of the day. You're not giving me the picture all day. Are you following me or no? So come to me and fast. I've been saying that for years. Now there is a study came out right here. Post-prandial, after meal, triglyceride gets up in the first 2 hours so high, and by 2 hours it goes inside the cells, already hides immediately. By the time you go to the doctor, it's already inside the cell. Are you following me or no? In this study right here, when we took women who have high triglycerides in their blood and give them omega-3, they reduced their triglyceride by 38% after meal. Listen to that. When they told her to exercise, it was reduced by 50%. American Heart Association just announced that taking 2 to 4 grams a day of omega-3 is must for every adult in America. That's the first time American Heart Association starts sponsoring food supplements. And that's every single day. But it has to be under physician supervision, because that's American Heart Association, so we must benefit somehow from you. So I'm just kidding, but that's probably what it means. But I think what they mean by that, if a woman is pregnant, is going to take omega-3, they want to be sure it doesn't have mercury in it, because the baby will be deformed if it has lead or mercury in it. That's probably what it means. Now, we're going to go to the next article here, which actually, well, forget about that. You're not going to understand it anyway. I'm just going to go to the next one. Anyway, let me just explain something about what I just was about to say. There is triglyceride, there is HDL, which high density, there's LDL, which low density, but last lecture we said the VLDL is the most dangerous. You remember that, right? So the one I skipped, that omega-3 actually converts VLDL to LDL. So when they did the study, they find out the LDL went up when they ate fish. I said, my gosh, well, how can the LDL go up? But they went back to check the VLDL went down. So the VLDL went to LDL, and probably the LDL will go to HDL. You understand? It's a molecular structure function. Metabolic syndrome. Oh, how did this get here? Well, let's see. I was in the car, so I must have done something wrong. So let me just put it back and put metabolic syndrome right here. And this one will be the next. Okay, metabolic syndrome is and diabetes. You know, metabolic syndrome is the syndrome that you have high triglyceride, high LDL, high VLDL, low HDL, high blood pressure, fat around the waist that you can feel it, and then the waist size increased compared to when you were a teenager or something like that, unless you were a fat teenager, and then insulin resistance is up. Now, omega-3, here are the studies. This is why I put this paper. The reason I'm putting this paper, because I want you to, if you're going to use this video for teaching, you have the paper itself, you can put it on the screen, and you can pause and read it with people who can read it. You follow me? For teaching, for somebody who wants to do that. Okay, omega-3, in a study, found to decrease the fat around the waist. So eating omega-3, it decreases the fat around the waist, decrease high blood pressure, decrease also triglyceride, and help metabolic syndrome. It's up here. One study have shown, here we go, that, with that cell I said I'm going to show you later, but probably I put it away. It's under here someplace. Anyway, do you remember when I said, let me put this out and then just, I drew another picture for you, it's faster. You remember I told you the cell, it has a guy sitting right here, goes and get the sugar, take it to the mitochondria. His name is GLUT4. Okay, here's the study about that. One study shows omega-3 increases the amount of GLUT4 only in the fatty tissue. So you burn fat a lot faster. So the fat cells, the adipose cells get burned a lot faster, but when you take omega-3, muscles don't get wasted, but the fat gets wasted. That's another study. In another study that is a nurse study, 5,103 nurses with no heart disease at all took omega-3. In the research, they're all women. They have very low heart disease when they became adults. Even the fish doesn't have omega-3. We find out eating fish, it has a protein in it. Fish has protein. That special protein in fish is not in beef. It decreases microalbuminemia. When you lose protein in the urine, when you have kidney damage, it helps those patients who have kidney damage. So eating fish also helps the kidney. Diabetic neuropathy. When you have diabetes, you have numbness and tingling, and you have problem with nerves, right? You probably know that if you have diabetes. We find out the speed of the nerve from the head to the arm and to the leg goes faster with omega-3. Nerve conduction velocity increase in diabetes. That was the metabolic syndrome. I found another one upside down, so I have to take a pause right here. High blood pressure. Omega-3, in 31 studies, they find out omega-3 by itself with no diet, with no other food supplement, decreases systolic blood pressure by 6 and diastolic by 4. Now, when you add you add other food supplements to it and take about 3 to 4 grams a day of of omega-3 and you lose weight, it decreased systolic by 13%, diastolic by 10 points, which is very significant without medication. This is the one I was, the last thing about the heart, and then the heart will be over with. Okay. In this article right here, I have put in this in, okay. The omega-3, that's number 7 benefit, by the way, so far, increases the atrium contraction. And people who have, the heart have atrial and ventricle, and when the atrium doesn't work properly, you have fibrillation, atrial fibrillation, and you have blood clots and things like that. Improve atrial function significantly. Also, number 8, increases nitrous oxide, the nitric oxide inside your blood. Nitric oxide is what Viagra was made of. Okay? So increases that's what nitroglycerin is nitrous oxide. That's why nitroglycerin give you a headache. Because nitroglycerin give headache, some of you know that, right? The reason it give you a headache, give you lots of blood to the brain. So you have a headache. But the heart is getting lots of blood. The angina gets better. Okay, that's why we use that. So we have, they have developed the long-acting nitroglycerin, and they called it Viagra, so they sell millions of dollars for it because they were not selling enough for nitroglycerin. So it's better to sell 6. So that is why they did it for. 90% of things you see in society is built around it. Number 9, omega-3 decreased adhesion of the free radical to the lining of the arteries. And number 10 is very important. It's also in this paper right here. When you have blockage in the neck right here, and the blockage can get loose and go to the brain, you need the plaque to be stable together, stuck to the wall. You don't want it to come loose because it will cause stroke. It stabilizes the plaques. It makes the plaques stick together, and when vitamin E and other procedure like chelation and other things do, that takes it slowly then out. There is also, this is the paper that we want to show you here. This is one we just talked about. There is also non-cardiac benefits. This is why I said the lecture is going to be a little bit long, and I have to watch time already. Have spent 1 hour. We're going to go through that a little bit fast. The autoimmune disease, omega-3, it decreases arachidonic acid. That the acid that was shown right here. Right here, you see arachidonic acid production. It decreases arachidonic acid cascade when you take omega-3. Now, when you have that decreased, this means there's a decrease in inflammation. How does omega-3 do that? Because omega-3 is 20 carbon atoms, and LOX and COX enzymes that cause inflammation, you will have COX inhibitor, LOX inhibitor, they block LOX and COX. So also the COX inhibitor and LOX inhibitor like Viax and all of that, they need also 20 carbon atom fatty acid to make it. So when omega-3 comes in, it competes with the COX and LOX right here by taking it and converting it that way with 5-delta desaturase and convert it to another thing rather than to inflammation. So what happened when we see the research studies, we find out that the amount of inflammation was inhibited, and rheumatoid arthritis especially, there was less tenderness in the joint and morning stiffness when they take 4 grams a day rheumatoid arthritis for omega-3. Ulcerative colitis and Crohn's disease, there is significant decrease of the amount of steroids they have to take when they took 5 grams a day of omega-3. The amount of steroid they had to take was decreased significantly. When they added vitamin E and C and selenium and manganese and beta-carotene, then there is another benefit. There is more benefit to the patient who have arthritis when this was done. Okay, we're going to switch to another subject, very important, is depression and mood disorder. This is very important studies right here to know that long-chain fatty acids right here is very important in depression. The brain is made of 60% fat, and 90% of the 60% is omega-3 inside the brain. So when there is more omega-3, there is more elasticity inside the brain, and there is more excitability inside the brain. There is less depression, and there is more synaptic function. There is more serotonin and dopamine and things like that come out. So the study have shown, Chinese study for shown in China, the amount of omega-3, when it was decreased in a society, in their country, in some people, in the mountains, in the city people, they had less omega-3 in their city, and more omega-3 in the countryside. And the people who have less omega-3 in the city, they had more violence, more depression, and more suicide, especially among women. And societies in general that has less omega-3, it has more violence. Study has shown that. And more suicide and more depression and more anger. And people who are angry all the time also have found to have less omega-3 inside the serum brain. So if you have a husband who's angry or a wife, give him more omega-3 rather than giving drugs. Okay, in patients who have depression and taking medication, taking 1 gram a day have improved their depression. People without antidepressant, when they took 2 grams a day, depression was decreased. So it is very important to take like 2-3 times a day of somebody who is depressed of omega-3. It does help the membranes. Bipolar depression, that is the people who get up and down so rapidly, they go depressed and they throw a knife at you and all of this stuff. They found in the bipolar depression, they had to go up to 6.2 grams a day of omega-3, and it took a little bit longer, but they eventually achieved. There was a study comparing the patient who take olive oil and patient took 6 grams in bipolar depression. Bipolar depression was improved in the people who take an omega-3. Then we just not going to be talking a lot about the age spots and senility. And this is the picture I have shown you before about when the brain is damaged. And the slime inside the brain, the antioxidants, the oxidation, the free radicals right there. We have shown you this picture in the past. And don't wait until you have memory loss. You can do something about it. That is something we have talked last year about. And here it is. The age spots in your skin signaling that brown slime is forming in the neurons of your brain. Okay, so that's what we do when we study our patients and we try to give them methylation treatment or any procedure or give them vitamins, try to remove some of the stuff out. We do that like once a month, But if they're not taking omega-3 themselves and take care of themselves, there is nothing I can do to help them out. I want to talk about another subject before the time runs out. I still have another 20 minutes, I think. Okay. This is important because it's maternal and infant care in omega-3. That's something really, really exciting when I found this article here, because I didn't know it myself. That omega-3 level found to be decreased with pregnancy. That the longer the pregnancy, the first month will be high, that it goes down. And the reason behind that, because the baby makes his brain in the last 3 months. And the brain is 60% fat, most of it omega-3, and that's why he sucks all the stuff from his mother. Omega-3 level decrease with pregnancy, especially, which cause postpartum depression. So we know postpartum depression is related only to omega-3. It's not related to anything else. It's not your father or mother, your husband did it, or the baby or anything. There was 41 studies done and shows there is decrease in omega when they study the milk of the mother who depressed, they find also decreased omega-3 in her milk. During pregnancy itself, the mother needs about 3 grams per day of omega-3 during the whole pregnancy. Under physician care, it must be a good brand, no chemical, no mercury, because all you need to give a mercury to that mother, to give it to that baby, he's going to born with ADD and other things. Because here are the studies to show that during gestation, the increase in omega-3 decrease premature delivery. Increase in omega-3 decrease preeclampsia. 3 grams per day. Women with normal omega-3, all of them has full-term delivery, not before the term. Studies have shown that that omega-3 is very important in the last 3 months because the brain is being formed. Studies also have shown that during breastfeeding, when mother have taken omega-3, the baby itself, cognitive function improved, and sleep pattern improved, and IQ score was improved up to the age of 4, compared to the children who did not have omega-3. Studies have shown also that the parents who have allergy and have babies, the children have allergy because their parents had allergy, their allergy when they took omega-3 was decreased significantly, and they find out is because they make more IgA and CD4. I just like to explain that if the mother herself have allergy and taken omega-3, the child will have less allergy in the future because the child will have more, she will give in the child more IgA and CD4. Children itself, the baby itself when it's born from allergic mother or a mother with lupus or a mother with Crohn's disease or a mother with autoimmune disease or something, given 185 milligrams of omega-3 to the infant born every day from age 6 months to 3 years of age. It is recommended if the mother is breastfeeding. If the mother is not breastfeeding, he needs it when he's born. If she is breastfeeding up to 6 months, she can wean him off at 6 months and start giving the baby omega-3 from 6 months to 3 years of age. After that, it goes higher. You remember you cannot give fish oil itself to children because fish oil has what? Mercury in it, and you have to be careful with that. The next subject we are going to talk about is vision, the eye problem, and how omega-3 plays an important role. Okay. The retina is part of the brain. The retina, it has very high percentage in it omega-3. So vision is related to omega-3 because the retina itself is made of omega-3. So, okay, here the study showed retina have the highest level of omega-3 in the brain. Study showed that children with less omega-3 have decreased vision. Study have shown children with decreased omega-3 have also, when you give them omega-3, their vision improve and they don't need glasses after you give them omega-3. Study have shown macular degeneration with age have decreased when given omega-3. Study have shown a disease called retinitis pigmentosa, which we have to put it in the lecture here. You probably don't have it, but it is a disease which people who have lack of certain enzyme called the delta 5 reductase, they cannot formulate certain light, they cannot see certain things in their vision, and they have a problem with that. Those people, when they took omega-3, it took 2 years before they seen an improvement. So they got improved, but they have to take it for 2 years first before they see the first result. Now, the Alzheimer also was mentioned in the study that 815 patients have taken omega-3. The majority of them, when they grow older, they did not develop Alzheimer's disease. Study have shown also that the nerve cells, I have to really draw a picture of that, and I still have enough time, but the nerve itself, when you look at the nerve cell, it looks like this. It has a tail like that, and the transmission goes from here to here like that. In the end of a nerve cell, the little things right here secretes stuff. Serotonin, dopamine, acetylcholine, all the stuff that excites you comes out like this. They find out that given that omega-3 have increased the production of the stuff that the Alzheimer patient lacks, the serotonin and the acetylcholine and phenylalanine and tyrosine and all this, tryptophan, all the stuff that they need. Now we're going to talk about what's the side effect of high doses of fish oil. If you eat lots of fish oil, that it has potential of having heavy metals in it. It's also, if you eat lots of it, you have burping, that the aroma comes out. If you take lots of omega-3 capsules on an empty stomach, you might have fish odor, smell yourself. So how do we solve that problem? We find out if you take it with meal itself, you will not have the fish odor. That will decrease. But in general, this article says, what type of fish you should eat and things like that also. We already covered that point. Taking fish oil, omega-3, without vitamin E and C and beta-carotene, it doesn't work very well. So it is important, if you have enough E and C and beta-carotene, you're not going to see the side effects, the upset stomach and the problem with it. The capsules in the marketplace, most of the capsule made from pork gelatin is not from beef gelatin. And lots of people, for religious reasons, the Jewish and the Muslim do not eat pork, and also for other religions don't eat pork, and some people are allergic to pork. So in Shaklee, they address that point also. There is no problem with that. When you take omega-3 and you're taking Coumadin or aspirin, you should ask your doctor, because your blood, omega-3 makes your blood thin, so you don't have a stroke. It can become too thin if you're taking Coumadin or taking heparin. So you have to check with the doctor, the INR, to decrease the Coumadin and heparin, not decrease the omega-3, by the way. That's the point right here I try to make. Okay, now we're going to summarize the lecture in all the stuff we talked about today in a scientific way that you're probably not going to understand most of it. So omega-3, in general, stimulate nitric acid inside the body, which does all kind of things. It improves insulin sensitivity. will lower blood pressure. Increases omega-3 in skeletal muscle and phospholipid, help decrease fatty, having too much weight. It's help membrane fluidity, phospholipid content, regulate gene expression. Omega-3 help the mitochondria, coupling protein with fatty acid oxidation in the liver and skeletal muscle. Omega-3 also, I told you it helped you to lose weight, but I didn't explain it. Here it does explain it. It said it reduces body fat by increasing the heat inside the body, so you're burning so much fat when you have omega-3. And I explained it to you by the GLUT4 will go and try to find sugar, cannot find sugar, it takes fat and put it in the mitochondria and burn it. So you have a furnace going inside, you're burning yourself. So the diet becomes very important in this issue also. It has all kind of function, decreased triglyceride, increased glucose uptake, increased glycogen storage, improved glucose tolerance, intracellular, inter-organ fuel partitioners, directing fatty acids away from storage. Anyway, these are the scientific things I want to put in the lecture for you so you understand there is a scientific basis behind omega-3. Omega-3 is becoming #1 food benefits in the world, have exceeded vitamin E, have exceeded vitamin C, have surpassed already vitamin and beta-carotene, have surpassed Flavomax, have even gone beyond soy protein. So omega-3 becoming #1 supplement. And the problem is how I'm going to take 3 times a day, or 6 3 times a day, or 10 3 times a day. It's not my problem. If I have lupus, I have to take 6 3 times a day. That's better than dying. If I have multiple sclerosis, I take 3 times a day, or 6 3 times. That's better than having no mobility and being in a wheelchair. You follow me or no? Most of us don't need this quantity. Most of us need 1 3 times a day, or 2 3 times a day, or 3 3 times a day. It depends how young you are, how healthy you are. It helps calcium metabolism. It helps adrenaline. It helps endothelial function, improve cardiac function, and that was the summary of all these papers. The papers we have presented to you today, it's right here, the 9 papers. You see right there. And there are 39 papers so far I have reviewed for you for this lecture. And now I up to 69 papers now is being reviewed for this lecture, and that's in the tape. And so you don't have to call me and ask him a question, where did you get the information from, like he did with the protein lecture. I got about 100 calls. How can you say so much about protein? Who said protein is good? And I couldn't believe some of the calls from doctors. How can you say soy protein that good? What is bad for us? And I wanted to pull my own hair because I said, don't you see that Chinese and Korean, Japanese have less problem than us? Yeah, but it's a different story. You telling me on the phone that soy protein causes cancer in the breast when the Chinese have the lowest cancer of the breast? Oh yeah, maybe it's a different factor. I said, doctor, you need more food supplement. Okay, that's 99 papers so far. This is 129 papers right here so far been reviewed, and this is for your reference. And this is 159 so far. And this is why somebody asked me today, how are you feeling about the lecture? I told them stressed. I like to joke, I like to laugh, I don't like to get involved in these things. But I spent so much time the last 5 months going to San Diego, University of Irvine, go to conferences, and most of what I have gone to, paying between $600 to $4,000 fee tuition to get in for the lecture, for the 3-day lectures, and all about omega-3. The whole conferences were about it. It was unbelievable. To the point I called Joyce, I said, we need to put a lecture on omega-3. That's how the lecture came about. We put so many diseases. You notice and because it has shown itself to be the best. That's the total papers. I have reviewed 187 papers for that lecture today. Well, this is it for you today. I'm going to take some questions, and anybody who have any special question, you can come after the lecture, and I will talk to you later, okay, about it. Okay? Yes?
You talked about how many grams you need to take a day. I noticed in the bottle it says milligrams.
Yeah, a gram is 1,000 milligram. So, you can calculate 3,000 milligram or 4,000 milligrams. That's a good question. Thank you for asking that question. Any other question? Yes? Average person, how much you should take to lose weight. Weight loss itself is not going to happen that way. We have the new diet for weight loss right now. We are formulating in my practice, try to see, and we have finally succeeded finding a diet that you will lose weight even if you don't exercise, which made from metabolic syndrome X diet, which is fruits every 3 hours, followed by salads and vegetables, followed by soy protein twice a day, and so on. And you can call me at the office, I can tell you about it. But in general, if somebody wants to lose weight, that's what they should do. They should first eat properly, decrease their carbohydrate intake, increase their exercise, eat properly, know that their weight is not related to their fat. People think that your weight is related to you eating too much fat. That's not true. Fatty food doesn't, it's true not good for you, but fat is caused by inherited metabolic syndrome from your parents. You have defective gene that when you eat sugar or white flour, you convert to fat. That's the way it is. So when we switch from white flour and sugars, candy and chocolate, to fruits every 3 hours, the people have less tendency to eat sugar. They have no craving, they have energy, and then they did very well and they lost weight. When they exercise 60 minutes a day, they lose about 10 pounds a month. When they didn't exercise, they lost about 3 to 5 pounds a month with this diet. Omega-3, 3 times a day is needed for weight loss. Any other questions? Yes, sir. Ginkgo? No. Omega-3 is not contraindicated with Prozac, Paxil, with anything except Coumadin, like I said. But that's a problem of Coumadin, not the problem of Omega-3. Omega-3 anti-stroke itself. It prevents strokes, prevents heart attacks. So with Ginkgo, which give you more circulation, that's great. Ginkgo acuity is important to have that because it gives you more nitrous oxide, and that's improved circulation. There's no contraindication. Yes? Okay, this is a good question. Let me repeat it. Is the medical community interested in EPA? The answer is no. The medical community, when I talk to them, I find out the information I'm giving you right here is not published in our magazine. It's not published in New England or JAMA or Lancet. So doctors don't know about it. It's not published. It's published, it's right here. It's a scientific paper. Why? I don't know. It's the same dilemma for the last 35 years. Why did they fight vitamins for all these years? Why did they fight nutrition? I was arrested once with saying vitamin is good for you. So I don't know yet, but they are losing the battle. The reason behind more and more young doctors are getting to be involved in nutrition, and the internet has lots of information in this. The health food store have lots of information on omega-3s, and there are lots of companies selling fish oils all over the country. So the people are knowing this. But today's lecture, intentionally, is to tell you that fish is a better food for you than beef or pork or anything else. In general, that is, you should eat fish like 3 times a week, 2-3 times a week, and beef should be cut to 1 to twice a week, and poultry will be twice or something a week. In the meantime, maybe a couple days a week, you should eat lentils as a source of protein, or beans or something like that, rather than animal product. The medical community starts slowly getting into it, but it's been already 4 years or 5 years since omega-3 is becoming a very important issue, but eventually they're going to know about it. Any other questions? Yes, sir. No, it doesn't. Distilled fish oil, it does not, because they don't have any capacity to extract the mercury. It's too expensive to do that. You have to have so many chemical reactions. You have to dissolve the whole fish in alcohol, and then you have to get the mercury out through EDTA, and then put it back. Then the bottle of fish oil this big will cost about $200, and it will be too expensive for them to sell. This is why, and also when you drink it, which I have, a patient of mine brought me 2 bottles as a gift, so I had to use it to see what it tastes like. And I have difficulty because it goes in but leaves all this stuff in the mouth, feels like soap or something. So I don't like it. But does it have mercury? Yes, it does. But if a patient gets chelation, like some of my patients do, they get some EDTA sometimes, in that we remove the mercury from them. But Shaklee in general doesn't have that in their capsule. Any other questions? Yes? Yeah, that's true. That's a good point. I'm glad you mentioned that. Let us look at the difference between 2 types of fish. The fish that are grown in fish farm, and the fish is grown in the wild. In the wild, they spend about 18 hours a day eating algae to make the omega-3 in their body. And they make it from algae. In the fish farm, they give them corn, so what they make inside their body, omega-6 only. They don't make omega-3. So they don't have they have omega-6, they have like flaxseed oil, they have oil, It's still good, you can, for the price, I'm not going to go buy a wild salmon for $18 a pound, $20 a pound. I'm just going to buy the regular fish I'm going to eat, enjoy my fishing, and eat it from the wild, and take extra omega-3 that. But the fish in the wild have lots of omega-3. The fish in the fish farm doesn't. The size of the fish is important, like you said. The smaller fish, like salmon, has a lot more in it than the larger, like tuna. But they both have good. But the bigger fish also can go to the bottom of the ocean very deep and can get more DDT and mercury and PCB like whales, where the little fish cannot go that deep to get it. So that is going to be a problem with the big fish. But fishermen like bigger fish. So that's the fun part of it. Yes.
So when people ask us about flaxseed oil, how do you get the recommended?
Flaxseed oil is flaxseed oil itself is not bad product, or olive oil, but GLA and omega-3 3-to-1. Like if you're gonna take omega-3 3 times a day, you take GLA 1 a day. If you take 6, you take 2 GLA. If you take 9, you take 3 GLA. The ratio 3-to-1. Okay, but flaxseed has nothing to do with that picture at all, because GLA itself in Shaklee is superior than flaxseed because distilling the oil by heat and extracting it from flaxseed seed, it destroys lots of the cis and trans atoms that I have showed you earlier right here. If you remember that cis and trans right there, it converted from cis to trans, which makes it less effective inside the body, even as flaxseed. So the process itself is important. It's a heating process, yes. That's another problem. In the oil itself of flaxseed can get rancid by oxidation. Yes. No, I think it's better always to spread supplement during the day with food. the idea of taking it all at once, like I do most of the time myself, is not the best way. I do it because I live in the morning, come at night, and that's not the best way. But the best way is to eat 3 meals a day or 6 meals a day and take some supplement with it. That's the most effective way. It's not the way I do it. Yes, sir. Like I said in the lecture, when they gave C and E and beta-carotene and selenium manganese, increases effectiveness, yes. Yes. In the study, we have seen C and E and beta-carotene. Selenium manganese is the one used in the study. But maybe we need more studies, because when you read a study, it tells you we need more studies. You know, when you read the paper, it says we need more study. We need more studies, you know. But you know, I asked one, I went to UC Irvine, California, to in a conference one time, and I was asking the scientist, who is a young man who was about 30-something years old, about a subject called nutrigenomics, nutrition for genes. So that's the new things right now universities like Irvine in California doing, at Harvard and Stanford. They're trying to figure what genes do you have is defective. What supplement to give you to counter that gene. And that's going to be the future for nutrition. We're going to be able to analyze everybody's blood different, and probably Medicare will pay for it, you know, for the older people, because they pay, they don't object to that. But for the insurance company, they probably will object to that. But that's the problem. All you have to do is do the gene typing one time and know what supplement to take, and that's for lifetime. So there is big future in that field. So I asked him, why you do that research? Why are you doing it? How did you get the money? He said, because the National Institute of Health gave us so many millions of dollars for research, and we do what they want us to do, and there's extra for us to use it the way we want to do. So we diverted it toward fish research, omega-3, and only California can do that, because it's a liberal state. They do whatever they want. They have their own laws, and they are environmental people, you know, very much involved over there. They're free thinkers, and they're not stupid as the rest of the nation, you know. They really are. I'm proud of the scientists. When I go there to universities there, Stanford, and I say they're such a free thinker, they're not afraid of anything to do. Government or anything. When you go to another Kansas City or Colorado, they, no, I can't do that because my budget gonna be cut and the government gonna get mad, the drug company gonna get mad at me. Well, California, he said, well, I don't care if I lose my job, I just go fishing, you know. So they're not kind of people tied to their job. The job as a fun part of the life. That's what I have noticed. They work in the morning and those skiing at night or surfing at night. That's their life, which is good life. Any other questions? Yes. Milligram. Okay, I said grams. Grams, 6 grams a day. No, I said three times a day, probably for MS. 3 grams, 3,000 milligrams. You have to calculate how many in each capsule. In Shaklee, it comes to be about probably close to 3 to 4 capsules 3 times a day. That's how many a day. So the problem right here comes to expense, how much is going to cost. But also you have to also think about the disease itself, lupus or Crohn, ulcerative colitis. You know, you got to watch which way you're going to go. I already mentioned to you that given high dosage of omega-3 decreases steroids, even ulcerative colitis and lupus. Is that good enough? It is good enough. But the problem is price. The prednisone, your insurance pay for it. Omega-3, you pay for it. But in the very end, how long are you going to take steroids anyway? So you know what I mean? You're limited. So omega-3 in any quantity didn't cause any problem. However, it's a matter of how much you can tolerate before you have nausea, before it gets too expensive. So we started, like Nancy said right there, 3 times a day. go to 2-3 times a day. The GLA, 1/3 of that. That's a good safe ratio. You can, and some of the study about depression, like I mentioned to you, they only given 2 grams the whole day, and the depression was improved. So even 1 a day is going to do some good. Somebody have no money, I said 1 a day is better than taking something else. Omega-3 comes ahead. Yes. It will become, they contradict each other when the manufacturing process is not compatible. It will become too oily. It affects each other. And also the capsule will become too large. And you cannot swallow it very easy. It gets stuck in your throat. You know, you have to ask the manufacturers why certain sizes. They do it that way for, they have experiments, you know, how many people can take and how do you take it. There was somebody right here. Yes, sir. Not corrected, improved. Yes, in the papers I put there was a paper about retinitis pigmentosa. They didn't go away, but improved after 2 years. No, the research is primitive research. It needs more research on that. But at least there was some hope for them, because it is a very difficult disease to treat. Any other questions? Yes, way in the back. There is not much work being done on it, but there are research now is being going about Parkinson, and it seems like there are benefit for omega-3 with Parkinson. Probably three times a day with Parkinson patient will show some improvement. 3 capsules 3 times a day of the supplement. Yes. My own patients, I'm not ophthalmologist, but my own patient who had macular degeneration, one specific patient I have in mind who had multiple sclerosis and macular degeneration and optic atrophy, has been stabilized for the last 20 years. Did she get better? I don't know. Did she get worse? No. Because she goes to ophthalmologist and he tell her, you're still doing fine, you're still doing fine. So macular degeneration, in the article I mentioned, age-related macular degeneration improved with omega-3. That's what the article says. For the dose, probably 2-3 times a day is sufficient for that. And the reason behind it, again, the macula is part of the retina. The retina is 90% is omega-3, and there is a deficiency in omega-3 we have noticed in the brain of all of us. No wonder the vision will be improved. And I already mentioned to you that children, the babies, their vision acuity has improved with omega-3. Any other questions? Yes.
So the mother is breastfeeding.
Yes. The mother give it to the baby, and she must take it in the last 3 months when she's pregnant. That's the time the head of the baby is formed and the brain is formed. So the last 3 months and the first 6 months of the baby's life, she's responsible for that. After that, the baby itself can take 185 milligrams of omega-3 in his formula up to 4 years of age. Yes, sir, in the back. There is no research showed that it did cure lupus. Lupus is autoimmune disease, but I probably taking omega-3, eating the proper food, taking the food supplement. In my own practice, I have seen the titers of lupus come down from 1,280 in some patients, 2,000 down to normal, or down to 80 or 40 or something like that. So I've seen improvement in lupus patients. About what? Stroke? Oh yeah, it's excellent against strokes because I told you it's in the physician study, It has improved against stroke. And the nurse study I mentioned improved against stroke. And I said even the warning in the end, I said, if you're taking Coumadin or blood thinners, be careful because omega-3 is going to make your blood more thin, means less stroke. And also, if the stroke caused by the atherosclerosis plaque is unstable, it's going to come loose. You know, when you play sports or sleep or something, it stabilizes the plaques. Maybe it causes adhesion together so the plaque cannot come loose when you're walking or running or having high blood pressure or something like that. These are the study I can quote you for your question. Yes, sir. Oh, yeah, exactly. Get theirs from fish. Yes. A conjugated linoleic acid, right here it is. Linoleic acid is right there. Conjugated CLA is also important because it works through the pathway making GLA inside the body. But the human body have difficulty converting enough EPA, 20 carbon atoms with 5 bonds and all of these things. They have difficulty in the human body. This is why we have to take CLA and take omega-3 and take different oils because they all have different things in it. Oh yeah, it helps the membrane too. But right now, the whole research is going on in the world. Since the Eskimos, 1950, was found to have free of most of the diseases. Now we found out the reason was the long chain omega-3. That's the reason. Now we're concentrating on the wild salmon. Now there's not much wild salmon left.